As we've mentioned, federal public health experts and members of the White House coronavirus response team held their first briefing Wednesday on the pandemic. CDC Director Dr. Rochelle Walensky spoke about the variants emerging in the U.S.
We have been looking for them. The variants have been identified recently, seem to spread more easily. They're more transmissible, which can lead to increased number of cases and increased stress on our already taxed healthcare system.
The briefing comes one day after President Biden announced plans to ramp up the weekly supply of vaccines going to states and plans to buy 200 million more doses. White House Press Secretary Jen Psaki said the administration expects to get those doses by the summer. Dan Diamond is a national reporter at The Washington Post. He covers health, politics, and policy. Hi there, Dan. Great to see you. So at that briefing earlier today, we heard from other public health officials like Dr. Anthony Fauci. What stood out to you?
Well, there were a couple points that they made, Elaine, that I thought were worth repeating. One is their goal of having more people on hand to put shots in arms. They're amending federal rules to allow retired doctors, retired nurses to become vaccinators. They're also allowing more qualified vaccinators to cross state lines too. And Jeff Zients, the coronavirus coordinator, and some of those other officials talked about the goals of mass vaccine centers, upping the number of weekly vaccine supplies that make their way to the states from about 8.6 million doses to 10 million doses, and also purchasing syringes that will allow more doses to be taken out of each vial. I think, Elaine, they also tried to draw a very firm line between what the Biden administration is going to do and what the Trump administration did or alternately didn't do. Some of that I thought was right. Obviously, the new president has a very different perspective than the last, but the U.S. was at a pace of about 1 million doses, maybe a little bit more, of shots per day. So the Biden administration isn't starting from scratch, regardless of what their officials say on the record or off it to reporters.
That's a really important point, Dan, some important perspective here, especially as this new administration is clearly trying to set expectations as we move forward in the months ahead. Well, Dan, yesterday you broke the story of President Biden picking a nurse to serve as the country's acting Surgeon General. What can you tell us about Susan Orcega?
Susan Orcega is a longtime public health specialist. She's a retired Rear Admiral in the U.S. Public Health Service, definitely not retired. She's been fighting infectious disease, Ebola, HIV, other diseases for quite a long time. What happened here, Elaine, is that we did have a Surgeon General who was poised to carry over from the Trump administration, Jerome Adams. He was highly visible as a spokesperson for the last administration on COVID-19. The Biden administration wanted to clear the deck. Even though Dr. Adams was scheduled to serve until September, the president asked him to resign, reached down and picked Susan Orcega as the acting Surgeon General. Her time in the job may be short because President Biden has tapped Vivek Murthy to be the full-time Surgeon General. Dr. Murthy used to be Surgeon General under President Obama. He's a close advisor of new President Biden, but confirmation that he needs from the Senate is still not scheduled. It may take weeks or months. Sometimes these stretch on for him to get in seat. So we have a nurse serving the role of the nation's, quote, top doctor for the foreseeable future.
And remind us, Dan, what does the Surgeon General do?
Well, the Surgeon General's role is a little amorphous, but the title and bully pulpit that come with the job, you're supposed to be a Surgeon General, the nation's spokesperson on public health, whether it's COVID-19, whether it's the seasonal flu, whether it's something big or small. That role is usually the person who goes out to face reporters like me. And under the Trump administration, Dr. Adams became a prominent voice, I would say probably after Tony Fauci, the second most prominent doctor that the Trump administration turned to. Surgeon General doesn't really make policy, but talks about policy and tries to explain it to the American people.
Well, Dan, today you also scooped that federal officials used funds meant for biomedical research on unrelated things in the years leading up to the pandemic. What was that money spent on, and where was it meant to go?
Elaine, I see that you are closely reading the Washington Post for all of our scoops. This was an Inspector General report that I scooped with my colleague Lisa Ryan, that millions of dollars from the Biomedical Advanced Research and Development Authority, or BARDA, were used for salaries, administrative expenses, even furniture removal that had nothing to do with their biomedical research mission. This was money that was deliberately set aside by Congress for biomedical research. The Inspector General said that there was some violation of federal rules and how this money was used, is pushing for a follow-up investigation. It's important to caveat that this investigation dates back 10 years, so largely in the Obama administration, and it isn't directly tied to more recent allegations about BARDA that a doctor named Rick Bright brought last year. He alleged that the Trump administration was misspending money. That wasn't the focus of this Inspector General report.
Finally, Dan, I want to ask you about something that I've actually gotten questions on from friends and family. So we know that there are a number of COVID case trackers, but there doesn't appear to be a single place to find reliable numbers about those who've recovered from the coronavirus. Why is that?
That's such a great question, Elaine. I think it reflects the patchwork nature of how the U.S. has responded to this virus, as well as the reality this is a novel virus, the novel coronavirus. So there was a lot that didn't happen up front, like mandating better testing at the beginning. There were lots of people who probably contracted coronavirus early last year, never got tested. We may never know if they were sick or not. There are people now who may not show up as having had coronavirus. When they are tested, they might not have the antibodies show up on the test. It may slip through the system. But I think the biggest reason is just different states, different jurisdictions have different definitions of what it means to have recovered from coronavirus. The most common definition is, frankly, you didn't die after contracting the virus. After some period of days or weeks, you made it through. That's obviously an important metric, but it's not the whole story. I was actually talking this afternoon to someone who contracted coronavirus last March, almost a year ago. That person is still sick, still dealing with the outcome of COVID. So this is a problem that we may never be able to get our full heads around, unfortunately.
All right. Well, Dan Diamond, Dan, the scoop machine Diamond, the Post is lucky to have you. Thank you so much for joining us.
I'm going to put that on my bio. Thanks for having me as always, Elaine.
Thanks, Dan.